Hey guys, welcome to my channel and let us start with today's topic, anatomy of the scalp. We will be looking at the extent of scalp, the structure of the scalp, arterial and nerve supply and its venous drainage. Firstly, we will be looking at the extent of the scalp. Extent meaning we will be looking at its boundaries. We will be looking at its boundaries anteriorly, posteriorly and on each sides. Anteriorly, the scalp starts from the supraorbital margins, going upwards and backwards till posteriorly where it ends at the external occipital protuberance and also the superior nuchal lines. On each side, the scalp extends from the superior temporal lines on one side to the superior temporal lines on the other side. And with this, we complete the extent of the scalp. Next, we will look at the structure of the scalp. Scalp is nothing but the soft tissue covering the cranial vault. Scalp is composed of a total of 5 layers. The word scalp is actually a mnemonic to memorize the layers of the scalp. SCALP. Starting from the outermost layer or the topmost layer, we can say S, that is for the skin with hair. We will look at each layer one by one. The skin is thick and hairy, and along with the hair there is presence of a lot of sweat and the sebaceous glands as well. The second layer that we will look at is the superficial fascia, denoted by the letter C. The superficial fascia contains numerous blood vessels and it is dense and fibrous in nature. Next, coming to the third layer, it is called the epicranial aponeurosis, denoted by the letter A. The epicranial aponeurosis is freely movable on the cranium along with the above two layers. It also gives insertion to the occipitofrontalis muscle that we will talk about later. The fourth layer of the scalp is made up of loose areolar tissue, denoted by the letter L. The fifth layer of the scalp and also the innermost layer is called the pericranium. The pericranium layer is on top of the surface of the bones. It is loosely attached to the surface, but it is firmly adherent to their sutures, where the sutural ligaments bind the pericranium to the endocranium. The top three layers of the scalp, the skin with hair, the superficial fascia, and the epicranial aponeurosis, are tightly adherent to each other due to the fibrous nature of the superficial fascia, due to which the skin is adherent to the epicranial aponeurosis. Now let's learn more about the epicranial aponeurosis. It is also called the gallia aponeurotica. Now remember how we talked about the epicranial aponeurosis gives insertion to the occipitofrontalis muscle. The occipitofrontalis muscle has two bellies, the frontalis belly in the front and the occipital belly in the posterior extent of the scalp. The occipital belly arises from the superior nuchal lines, that is the posterior extent of the scalp, and gets insertion into the epicranial aponeurosis. The frontal bellies arise from the anterior extent of the scalp, from the skin of the upper eyelids and the forehead, and gets inserted into the epicranial aponeurosis. In this diagram, we can appreciate how the frontalis bellies of the occipitofrontalis muscle has no bony attachments. Hence, the fluid present in the loose areolar tissue layer, it is free to pass into the eyelids and the subconjunctival area. The loose areolar tissue layer gives passage to the emissary veins. The emissary veins connect the extracranial veins to the intracranial venous sinuses. Now we will look at the arterial supply of the scalp. Taking the auricle as the reference point, starting first we will look at the supratrochlear artery and the supraorbital artery. both of which are branches of the ophthalmic artery, which in turn is the branch of the internal carotid artery. Next is the superficial temporal artery, which is a branch of the external carotid artery. We have looked at all the arteries in front of the auricle. Now we will go behind. Behind the auricle, we have the posterior auricular artery, and the occipital artery. Both of which are branches of the external carotid artery. Now let's look at the nerve supply of the scalp. A total of 10 nerves supply the scalp, 5 in front of the auricle and 5 behind the auricle. Out of these 5, 4 are sensory nerves and 1 is the motor nerve, both in front and behind the auricle. All the 4 sensory nerves present in front of the auricle are supplied by the fifth cranial nerve, that is the trigeminal nerve. They are its branches. Starting with in front of the auricle, we have the supratrochlear nerve and the supraorbital nerve. The supratrochlear and the supraorbital nerve both are branches of the ophthalmic division of the trigeminal nerve. Next is the zygomaticotemporal nerve. The zygomaticotemporal nerve is the branch of the zygomatic nerve. The zygomatic nerve is the branch of the maxillary division of the trigeminal nerve, that is also the fifth cranial nerve. The fourth sensory nerve present in front of the auricle is the auriculotemporal nerve. The auriculotemporal nerve is the branch of the mandibular division of the trigeminal nerve. After the 4 sensory nerves, the fifth, that is the motor nerve, is the temporal branch of the facial nerve. It is denoted in orange color because it is a motor nerve. Both the motor nerves present in front and behind the auricle are both supplied from the facial nerve. In front of the auricle, it is supplied by the temporal branch of the facial nerve, and behind the auricle, it is supplied by the posterior auricular nerve of the facial nerve. The sensory nerves that we have behind the auricle are first the great auricular nerve. After the great auricular nerve, we have the lesser occipital nerve. Then the greater occipital nerve. And finally, we have the third occipital nerve. These were the sensory nerves present behind the auricle. For the motor nerve, we have the posterior auricular nerve, that is the motor nerve, branch of the facial nerve. Now the last topic that we will look at is the venous drainage of the scalp. Like the arteries, the veins also have similar names according to where they pass through. Starting with the supraorbital and the supratrochlear vein. The supraorbital and the supratrochlear vein combine at the median angle of the eye to form the angular vein. The angular vein then continues downwards to form the facial vein. Then we look at the superficial temporal vein. The superficial temporal vein from the anterior aspect of the auricle continues downwards and combines with the maxillary vein. It combines with the maxillary vein to form the retromandibular vein. Now the retromandibular vein divides itself into two divisions, the anterior division and the posterior division. The anterior divisions combines with the facial vein to form the common facial vein which drains into the internal jugular vein. Now the posterior division of the retromandibular vein unites with the posterior auricular vein to form the external jugular vein. The external jugular vein ultimately drains into the subclavian vein.